Here's our next video in this series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We're in the middle of phase 3 now, and one thing that's changed is school is now out for the summer. And with this, some things are going to come up with Maddie going to a soccer camp at Auburn University, as well as a couple trips that the family are planning to take for part of their summer vacation. So after they're gone for a while, she comes back in and we do a little checkup. We start with a little warm-up, and we're going to go with the agility ladder. We can see here her going with 2 feet in. She's got a very good cadence as she goes through. She's very comfortable doing this. And you can see that when we zoom in on her feet, she's got a very even step length and she's on the balls of her foot. Again, these are skills she's familiar with. We're not surprised that she's doing well. The challenge that we have during this time is the fact that they may be away for a couple weeks, come back into town for a couple days, and then be gone for another 7 to 10 days before we're able to see her again. So essentially, when she comes back and we have a chance to get Maddie into the clinic, we're kind of seeing what she's done while she's been gone, assessing where she's at, sending a status report to the physician, and then trying to progress her program depending on the resources that she has. This is a little bit of a challenge because we know there's going to be some limitations to what she's going to be accessible to and the amount of time that she's going to have to do things like weight training to keep up her strength base. So when she does come back in for the next visit, we'll have to see how this is going to impact our ability to progress her functional activities. Now you can see as we've gone through the ladder here, we've done 2 feet into the front, 2 feet in laterally, and now we've gone through the shuffle progression. After she warms up, we went into doing the box drills. We saw these a few weeks back and introduced them. She's doing quick touches to the front. But then when we did the quick touches to the side, we could see she definitely wasn't as comfortable pushing off in the lateral plane, particularly on her left side. Because of this, we went back and did some more activity on the slide board, putting the barriers a little further apart, so she really had to push and not only push with the outside leg, but learn to eccentrically load the quad when she hit the next barrier. When we got her out on the field, we took her through the 20-yard shuttle that's seen here. These are a few warm-up runs that we had her do at maybe 30 or 40%. You can see after several repetitions, she was able to start accelerating and be much comfortable planting off the outside leg as she was going through the runs. We also progressed the bounding activities like you see here, bringing the cones a little further apart and adding a little bit more of a jumping motion and a loading motion to this. You see actually the deficit is in her ankle more than her knee, with having some ankle looseness from previous injuries. Fortunately, she has enough perineal strength to provide the stability that she needs. The last thing that we added that was a little bit new was some form running here. You see her going forward, driving the arms and driving the upper body. Once she takes up the slack, she actually begins pulling me along, and then once she stops, the tension will actually slingshot me forward. Now we did this both forward running and backpedaling, and at the end of the session, I'm not sure who got the better workout for quads, glutes, and hamstrings. Overall, Maddie's progressing well, and we just have to accept the fact she's going to have a limited ability to do weight training over the next couple weeks, and we are only going to be able to see her sporadically, and we'll have to see how she does.